Okay, I'm Dusty and I'm going to be inserting an indwelling catheter on my patient. So to begin, I have checked the order of my patient to verify that the physician has ordered an indwelling catheter. I also checked my patient chart for any allergies or any limited mobility. My patient has not been told about this procedure yet, but when I go into the room, I will inform my patient that we will be inserting a catheter, why, and that it is a sterile procedure. So now I'm going to move to my patient's room. I have all my supplies ready. And as I enter the room, I will make sure that the door is closed to provide privacy. Okay, Mrs. Jones, my name's Dusty. I'm going to be your nurse tonight. Okay, I'm just going to verify that I have the right patient. Okay, can you tell me your name and date of birth? Okay, perfect. Okay, Mrs. Jones, today I'm going to be inserting a catheter on you. And it's one of the catheters that will stay in until the doctor states that it needs to be removed. Okay, good. I'm glad you're okay with that. Before I begin, do you have any allergies? No? And you're sure you don't have an allergy to latex or iodine? Okay, perfect. Okay, so my patient does not have any allergies, especially to latex or iodine. So now as I'm repositioning my patient, I'm going to inform her why we are inserting a catheter. Okay, Mrs. Jones, I'm just going to reposition you. And so that you're aware, we are inserting this catheter so that you'll be able to use the bathroom without having to get up, especially where you are having some urinary retention and having to get up so frequently, and where you are on a diuretic. So that will help be able to be able to be more comfortable and not feel like you're getting up 24/7. To begin, I'm gonna just reposition your legs here, okay? So I'm gonna have you just relax your legs and separate them, and it will be in, I'll think about it for a minute. And dorsal recumbus position. I'm going to remove the brief as well so that my patient does not have that in the way when placing this catheter. Okay, to begin, I'm going to perform hand hygiene and apply gloves to do pericare. Okay, Mrs. Jones, to begin, I'm just going to clean your peri area, which is your vaginal area, which to keep you from getting an infection the best we can. Okay? Do you have any questions while I am getting this ready? No? Perfect. So I have my wipes here. Okay. And I'm gonna spread the labia and do one side, making sure to use a different part of the wipe each time, and then the other side. And then I will also go right down the meatus, which is right in the middle, and go from front to back. Okay, and then just to make sure, I'm gonna clean the area around the vaginal area. Okay, perfect. Okay, now that that's done, I'm gonna start my sterile procedure. Mrs. Jones, as I told you before, this is a sterile procedure, so I'm gonna ask you not to touch any of my supplies or try and help in any way unless asked. Okay, thank you for that. Okay, to begin, I'm gonna open my package. And remove my sterile container from the plastic wrap. Okay, I'm going to start by opening my sterile field, going away from me, it is pretty creased, so I'm gonna just take my time doing this. And I have that 1 inch margin around my sterile field. Okay. So I'm gonna move over here to my other table, perform hand hygiene, and place on my sterile gloves. I'm gonna wanna keep my hands out, making sure that they are sterile the entire time. So I open my gloves, making sure not to touch them. And to begin, I will grab the cup and place them. And I want to take my time making sure that they do not become contaminated. So where I have that finger that's stuck, I will fix it after my other glove is placed. And I want to make sure to stick my hand in the cup when placing it to maintain the sterile field. And I can only touch the outside of my gloves when performing this. Okay, now that my gloves are on, I'm going to start by removing this pair of gloves that I will not be using and drape my patient. So I'm going to carefully open my drape and I will place it in between the patient's legs, maintaining sterile fill. And then next I will place my second drape, giving me a bigger sterile field to perform my indwelling catheter. And I'm going to make sure not to touch any part of the patient that is not within the sterile field. To begin, next I will move the top of my container out of the way. And I will open my sterile swabs, remembering to keep my elbows up and my hands in front of me, and to always keep my sterile field within sight. So I'm just gonna pull my swabs up so that they are easier to grab when it comes time to do so. And I will set my second set of swabs off to the side. Then I will open my lube that I will use when placing the catheter. And I will also open the top of my sterile water off. And I'm going to just remove the excess air from my sterile water. If a specimen was needed, I would obtain that as soon as the catheter was placed from the bag. But today we are not going to be getting a specimen, so I'll just set that off to the side. So everything inside my box is sterile. So now I'm just going to slowly remove the covering of my catheter, making sure not to let the catheter just flop and break my sterile field. Okay. And then I'm going to place the tip of my catheter in the lube. I want to make sure to use that my catheter tip is in 2 to 3 inches with the lube on it. Now I'm going to place my syringe on the port to the balloon so that it can be inflated when the time comes. And then finally, I'm just going to place my open swabs in my container. And I'm going to move my box, making sure that I do not touch anywhere outside my sterile field. Okay, to begin, I'm going to start by using my non-dominant hand to open the labia before placing the catheter. So I'm going to use my dominant hand to clean as I do so. So I'm going to want to clean one side of the labia, then the other. And then lastly, I will want to clean the meatus going from front to back, making sure that it is completely clean. Okay, now that that is done, keeping the labia spread and my non-dominant hand dirty, I will remove the lubricant from the tip of my catheter. And making sure I have lube on my cath tip. I'm going to insert the tip, go about 2 to 3 inches. And when it is difficult, so now that I've got urine flow, I'm going to make sure to go 2 to 3 inches more. When it is difficult to place a catheter, you want to make sure that you are in the urethra instead of the vagina. Okay, now that that's done, I'm going to hold the catheter in place and then make sure to inflate the balloon. For this catheter, it needs 5 cc's. So I'm going to, before letting go of the syringe, I'm going to just slightly tug, making sure that my catheter is secured. So now that that's done, I no longer need a sterile filled. So I'm going to remove the equipment that I don't need anymore and get this drink out the way for my patient. And then I'm going to place my bag on the bed frame. And before starting the procedure, I made sure that the valve was closed so that urine would not just flow out of the bag. So I'm going to place it on the bed frame and not on the bed rail. And then I will remove all of my equipment, including my sterile gloves. Okay, now I'm going to perform hand hygiene again. And I would apply my catheter secure to keep the catheter from being yanked or pulled. And before I leave the room, I'm going to want to place clean gloves on and clean any excess iodine or lubricant that is left on the patient's peri area. And as I was doing this procedure, I want to make sure that my patient is relaxed. I told her that it was going to be an uncomfortable procedure and that afterwards it wouldn't be quite as bad as when the catheter was being inserted. So again, when doing peri-care after, you want to make sure that you use a different part of the wipe for each stroke. And then I would place a clean brief underneath my patient, ensuring that there is no chance of any stool incontinence leaking onto the bed. Now I'm gonna pull my patient's gown back down, put her in a comfortable position, and cover her up. And make sure the bed is lowered to the lowest position. I'm going to remove my gloves again. Okay, Mrs. Jones, do you have any questions before I leave? No? Perfect. Okay. If you were to tell me how bad that was, how would you say? Not as bad as you thought it was going to be? Perfect. Okay, Mrs. Jones, if you have any problems or are worried about your catheter in any way, let us know. Try not to pull on it and try not to touch it in any way, just to prevent it being pulled out on accident. Okay, perfect. Okay, now that I'm done with my catheter procedure, I will leave the room. Mrs. Jones is in a comfortable position, and then I'm going to document the catheter insertion and how my patient was able to handle it.